Welcome. Given the success of the World Book Night last night, we actually thought that we'd begin each of the conferences with a story from Dr. Brink. No, actually, don't worry, we're not going to do that. But actually, we are going to start today with Dr. Brink. Then we'll move to Dr. Raby, followed by the Chief Executive, Deputy Salisbury, and then I will add a few words before we move to questions. So just to kick off, Dr. Brink, thank you.
So thank you very much. So to start off with our daily update, we had no new cases over the last 24 hours, so we remain at 245 cases diagnosed within the bailiwick. So really encouraging information for the last 24 hours. We also now have 155 recovered cases, so the number of people recovering is increasing all the time, and we're down to only 78 active cases. So all of the parameters are looking really good from that perspective. We did sadly have another death, so we now have 11 confirmed COVID-19 deaths and 4 presumptive deaths. So a sad occurrence for us in that respect. But looking forward and how we move forward, there are just two or several things I want to discuss today. The first was the issue of vulnerable children. And I think what I'd like to stress here is that schools are open for vulnerable children, really important, but there are also activities that are also ongoing for vulnerable children. So, for example, the Croft is still running some of their respite care. And what they've also tried to do is look at moving some of that respite care outside. So good for general mental health and well-being, but also nice to get some fresh air, but also good for social distancing and so on. So really positive from that perspective. Social workers are still doing their visits, so all of those and the safeguarding visits are happening as well. So from a child protection and for our vulnerable children, those services are ongoing, and we really are keen to see these continue during what is a very difficult time for that group of individuals. So important from that perspective. So other things that we wanted to talk about today was our mortality. So mortality is our overall death rates, and we measure something called all-cause mortality. And I know some of you have asked me about death rates other than COVID-19 death rates over the course of this year. And we did say that we would publish that data, and we'll publish a full document on that. But what I wanted was enough data to analyse for me to be confident of our reporting. I go back to what I always say is the evidence. I'm sure you're all sick of me talking about evidence, but it really is important that everything I present is robust. So what we have seen is in week 15, we did see an increased mortality, and that was related to COVID-19 deaths. So during that week, we had an excess of COVID-19 deaths. However, one of the other things, and something that Dr. Raby has brought up on a number of occasions now, we are concerned about people accessing healthcare for things other than COVID-19. So encouragingly, our mortality for issues not related to COVID-19, so other cause of death, has remained stable. And we've analysed that and compared that to the previous 10 years average. So we think the data is quite robust. So an increase in COVID-related deaths in week 15, but other than that, our all-cause mortality has remained relatively stable. And as I say, that data will be available. I also wanted to talk about the children of the bailiwick again, and there is something called My COVID-19 Time Capsule. I think it's absolutely brilliant. Now, this My COVID-19 Time Capsule comes from Samuel, and he very kindly lent his My COVID-19 Time Capsule the work he'd done to date. So thank you, Samuel, but I'm also going to give you some information for Samuel's parents. So when Samuel asked how he was feeling, he said he was feeling very happy, so we're very pleased that Samuel's feeling happy. But when he asked how are you finding homeschooling, he said it was boring. So I think from Samuel's parents there might be some information that they need to take on board. But I do think this is a wonderful resource, and I think it is something that children can do now, put it away and show it to their family in years to come. These are unprecedented times, and I think capturing children's thoughts and feelings during this time is so important. And I think what I'm going to do is ask my 24-year-old daughter and my 22-year-old son to complete it as well. I think it would be good for them. So thank you very much.
Great, thanks. Thanks, Nikki. Dr. Raby.
Thank you. The hospital's quiet still. We have 4 patients in the COVID ward this morning. I'll just give you a brief flavour of what we're doing in the hospital. We're continuing to work up plans for how we would expand if we became overwhelmed, and we've got plans to a pretty good state of readiness for that, I think. We're working on whether we can start doing a few more outpatients that need to be seen face-to-face. We've been doing a lot of, there's been a lot of virtual consultations going on, remote consultations by telephone or video link, but some people do need to be seen face-to-face, and we're working with public health on how we can do that in a manner that's safe for everybody involved and doesn't risk the public. So we hope to be able to do a few more outpatient consultations safely soon. And similarly in theatres, throughout this time, the operating theatres have been doing urgent cases. There's still caesarean sections that need doing, people with cancer who need surgery. So that's all been going on in the background. You can imagine with the COVID-19 precautions we have to take, it's been really slow throughput in theatres, and work that you might get through in a morning normally is taking all day, because we have to clean the theatre completely between cases and make sure that one patient's out and before that can happen. So we're looking at how we can increase our theatre throughput again, because there's people who need operations. So we're working on both of those. I want to answer a question that some people have written to me about, and that's about why have people been dying in care homes when the hospital's been so quiet? And I think it's a really good question, actually, and it's not intuitive, perhaps. So the reason for that is that everybody who we think will benefit from being in hospital gets admitted to hospital. But sometimes when people reach the end of life, it's just not in their interest to move them around the island in an ambulance to somewhere that they're unfamiliar with and away from their home. It's just not compassionate. So we've been doing everything we can to support people in that position to have a dignified and compassionate death in the place that they're familiar with, and that's the reason for that. With the care homes, Care Home 1, we're working really hard with them to ensure that home, we would like to declare it a COVID-free place as soon as we can. So we're working really hard on that. We're doing lots more testing of staff and individuals in the home. We need a certain number of days of negative testings confirmed before we can say that. But as soon as we can, we'll tell you that. And there's encouraging evidence that a number of people in that home are recovering from the positive tests that they've had. So watch this space on that. Finally, from me, we've had a significant delivery of surgical face masks, which was our sort of tight spot for PPE, our tightest spot for PPE, and I'd just like to say a big thank you to Christopher Martin and a dental practice in Jersey that helped us source a significant number of masks that have arrived now, and we're really grateful for that. So that's me.
Before I pass over to Paul, just picking up on one of the first comments you made there, and perhaps you and Nikki could answer it between you. You explained that you're continuing to look at the capacity in the hospital and planning for more cases and not wishing to be overwhelmed. Could you just speak for a moment as to why that's necessary in the context of no new positives today, falling number of active cases, and why it's still necessary to be doing that planning?
Yes, Nikki will speak for public health on this, but in my mind we have to be prepared for a second wave should we get one, and to not use this time to best effect should we get a second wave of COVID would be negligent. So we're doing all the preparation, and we will get that place as ready as we possibly can for the worst case, and we'll all have our fingers crossed that we never get that. Nikki?
Yeah, I think that's absolutely right, is that we've always said that we will tackle this pandemic from multiple points, and that our mainstay would be testing, quarantining and contact tracing, but we also needed to have the facility to look after people within a hospital environment if the pandemic got out of control locally. And I think it's really important that we're doing really well, but we're not going to just sit back and relax now. We're redoubling our efforts. We want to keep it contained locally, but we also want to make sure that should it not be contained, we've got the facilities to care for islanders. So it's the combination of the two, and we've always worked on that, haven't we?
Great, excellent, thank you very much. Chief Executive, Paul.
Thank you. I'm going to concentrate mainly today on the business support arrangements and the announcements that were made earlier this week about the changes for the potential to return to business operations. We have received more than 1,100 notifications of businesses wishing to return to work after the 25th. Whilst the majority of applications fit within the public health criteria, some do fall outside. To help us get as many people as are eligible back to work as quickly as possible, please take a look at the guidance before you submit your notification form so that you can fully understand the standards you're obliged to meet and that you fit within the extended scope of the guidelines. All notifications that have been received have now been reviewed. Businesses that comply with the requirements will not be contacted, so if you don't hear anything further and you have submitted your form, then you will be able to operate from Saturday the 25th of April. Any business that should not be operating under the relaxed guidelines or need to provide additional information will be contacted before the end of today. Officers from the Environmental Health will be routinely visiting sites to check on compliance after the 25th of April, and they will also be investigating any complaints that are received. Businesses are reminded that it is in the wider interest of the island's public health to comply with the guidance, and that failing to adhere to the simple rules could lead to reconsideration or indeed a tightening of the guidelines. We anticipate that even when some business activity is possible under restrictions, many businesses operating will not be able to return to near normal levels of trading under Phase 2 restrictions. It's expected that the majority of businesses will continue to need and receive the maximum level of support. For the avoidance of doubt, therefore, businesses currently claiming payroll co-funding support who are able to return to some level of activity but are still experiencing a significant impact on their turnover will still be able to claim support. Payroll co-funding can still be claimed for all members of staff, including sole traders and business owners. However, in time, the value of support provided may be adjusted to reflect the increased level of activity in the business, and small business who have been awarded a grant will be able to retain their grant payment. Those businesses currently awaiting payment of a grant or eligible for support will receive that support. For absolute clarity, all this information is still available on gov.gg/coronavirus. We have now received more than 3,000 applications for business support and processed more than 1,700 payments to a value of around 5.2 million. It's worth noting that some of these will be new ones. There are improvements we do need to make, however. If you are a business still waiting for payment, it is on its way. However, we are conscious that we are receiving messages from people who are still awaiting the process of their application. We are putting as many people as possible in the team to improve and meet the level of inquiries we are now receiving. Since the virtual call centre went live at 10 a.m. on Tuesday last week, we have had nearly 1,800 calls. In an environment where many of the call operators are working remotely, it means the implementation of our virtual call centre last week has provided us now with a rich data source to help us improve our processing, which previously we haven't had. We are now able to see how many calls are going to each line, how long each one takes, and when we need to put in more resources. Our target is to get through the backlog by the end of next week. If you can't get through, then please have patience. We were dealing with an unprecedented number of calls, and inquiries will get to you as soon as possible. Thank you.
Great. Thank you very much, Paul. Heidi.
So tomorrow we start Phase 2 and start our exit strategy. And someone told me the other day, and apologies to Nikki for this, that we might be able to consider it back from the brink. But further to comments Paul has just made, I'd like to thank all the staff across the States of Guernsey who have enabled it to happen. It's been quite a logistical exercise requiring considerable cross-departmental working. The message remains, as we all know, stay at home if at all possible. But I'll just mention briefly those categories of business that will be allowed to operate subject to strict conditions as of Saturday. Gardening, building and other trades with no household contact, building wholesale and supply, vehicle servicing, maintenance, repairs, that includes cars, bikes and marine, and property sales, rentals and transactions. Changes have also been made in relation to the number of employees allowed to carry out non-essential work on office premises, subject to meeting, social distancing and hygiene requirements. Now, we've had a range of businesses asking to be included. These will all be considered either for the next phase or on an exception basis. In respect to the latter, we have had a request from a business that supplies the building trade, which has advised that it couldn't operate with a maximum of 5 workers across what is a large site. HSC has granted an exception on the basis that the site can be split into separate work zones with a maximum number of employees within each zone. I thought it was important to mention that because clearly people will see that there might be more people on that site, and to really prevent those questions coming up, that is the reason why that they will see that, but those employees will have to be segregated. Others were also considered today by HSC and will be notified shortly, and more will be looked at next week. However, there will be few exceptions as we need to undertake this phased release in a logical and systematic way. I know how frustrating this is for many, but it is important that we manage the process in a structured rather than haphazard way. As I said on Wednesday, we're looking at a transitional plan for recreational activities and expect that to be published early next week. Now, I do think it's an opportune time for me to send a thank you to those who haven't had much of a mention recently, but deserve to, and that is my committee. I think there has been confusion as to actually who is having to make the difficult decisions here. It's not the CCA. The CCA that comprises Deputy St Pierre, Lowe, Brayo and myself provides the powers to various bodies to take action in the fight against COVID-19. With regard to the nature of lockdown and easing restrictions of lockdown, it is a Committee for Health and Social Care. We make our recommendations based on the advice received from Dr. Brink, but also taking into account other relevant matters, such as how any change can be managed and the implications in terms of wider requirements. For instance, by allowing commercial gardeners to start work, we also needed to think about the waste facilities as well as with the construction industry starting. So all those things have had to be considered in the round. I'm therefore very grateful to Deputies McSwiggan, Prow, Tyndall and Tooley, together with the staff who have been supporting us, for the hard work they've put in reviewing directions and guidance and for their thoughtful challenge. We have had reams of documents that have come through at very short notice and they've turned them around really well. Above all, I thank them for their calm and considered approach during a period of what has been incredible change and where we've had to make momentous and incredibly difficult decisions at short notice for the benefit of the bailiwick. It is a team effort.
Okay, thank you very much. I just want to pick up on a couple of themes and really repeat some key messages. We made this very clear a week ago when we set out the exit strategy that phase 2, and Heidi's repeated it again this morning, as has Nikki. Phase 2 very much is stay at home. That is the key message. We do still want the vast majority of the population to be containing themselves within their own household bubble and seeking to avoid contact with other households as far as possible, albeit recognising that there is greater activity now. And I think in that context, again, we're picking up some messages and feedback that, for example, in relation to the shopping experience, there are more children being taken to accompany parents. It's becoming more of a family experience again. Repeating the previous message, nothing's changed on that front. It should be avoided if at all possible. Only take children if there is no other way that they can be looked after. And unfortunately, the distancing is still required in shops, so the patience is still required in that environment as well, and also frequency. Try, as Dr. Brink has said on a number of occasions before, to avoid, to reduce the frequency with which you need to go to the shops. So one bigger shop rather than several little shops. These are key messages, and I think it is easy for us as we go into week 5 of this experience, as things start to ease, that we can risk becoming complacent about some of these things. It is critical that we do maintain distance from each other in a physical sense, and that remains critical. The business support angle, which the Chief Executive has mentioned, again, we absolutely recognise how critical this is, that if you are a business owner and expecting support that's been promised by government, and that application has been submitted a few weeks ago and you haven't heard, it is immensely not only frustrating for you but worrying for you, and we do know that. It is a very high priority for us. It's been on our radar, particularly in the last few days as we head towards the month end and towards the period when those businesses are going to need to make payroll payments to staff. So the additional resource is being put into that, and it is an absolute priority for us. So you do not at any moment feel that the government has abandoned you, because we haven't. It is simply a question of getting through the volume, and Paul and his team are absolutely doing everything they can to get through it as quickly as they can. So please continue to hold faith that we will get to the bottom of the pile, and you will get the sums to which you are entitled under the various schemes. I think the final thing I just want to mention before we open up to questions is in relation to the question of borrowing, which has now obviously been put into the public arena from the press conference on Monday, from the publication of the policy letter a couple of days ago. And quite a number of people have contacted me to ask whether they will be able to participate. They would like to have the opportunity to be able to support the local economy by lending through this process, if borrowing is indeed required in due course, and how would that happen, and so on. And I think what I would say at this stage is we haven't really got to that level of detail. We absolutely recognise there is an appetite out there for the local community to support this. And all of the options will very much be considered. The first priority is to get over the next step, which is for the state's deliberation to provide the delegated authority and the flexibility that Policy and Resources is seeking to be able to consider this further down the line. That debate, subject to the presiding officer, subject to the bailiff's decision, is likely, and the state's indeed agreeing, is likely to take place next Wednesday now as an additional state sitting. We have also now scheduled a video briefing for states members on Monday afternoon as an opportunity to give a greater discussion before the debate itself. We absolutely recognise, as I said on Monday, the scale of this is enormous. As eye-watering was the phrase I used, and that is correct. And it is absolutely right that the states should challenge and should scrutinise before they make such a decision. But absolutely, the priority remains that we, from Policy and Resources perspective, that we do obtain enough flexibility that we can respond to this as we develop our recovery plan in the coming weeks and months. So with that, I think we'll open it up to questions. So who'd like to start? Rosie.
Thank you. Rosie Alsop, Island FM. It's about hospital capacity and Jersey's Nightingale Hospital. Jersey offered that Guernsey patients could be treated at their Nightingale Hospital if necessary. I just wanted to know what your reaction is to that.
Yeah, shall I answer
Please.
that?
Thank you.
I'm obviously grateful to Jersey for that statement, and we'd be in exactly the same position. If Jersey was overwhelmed in any way, we would do all we could to support our sister island. And actually, to be honest, we'd support our hospitals in the UK if we had to, and we were in a position to. Why not? Let's hope we never get to that position.
I think practically, though, you have to consider how that would work. I mean, sending symptomatic and sick people from one island to another, I think would be quite a logistical exercise that, as Peter says, hopefully won't be in that position. We've got our own contingency work we're undertaking as well.
If I'd add to that, we know that transporting critically ill patients around increases their mortality, so they don't do as well if we have to ship critically ill people around. But there might be ways we could work together, moving staff around and things like that if we have to get to that position. So there's other ways we could look at that sort of problem.
Great. Okay. Yes.
Juliet Puto from the Guernsey Press. we've been talking about the phases and how we're moving through them. I was interested to try and find out how we're deciding when we move between the different phases. I know in America, I think they've got, is it 14 days of falling cases they can then look to relax a bit? And also, do we have a timescale of when we could possibly get back to normal within the island? I know obviously outside the island, but obviously if we manage to get the number of cases low enough in the island low enough, do we have a timescale of when we could go back to vague normality?
Who'd like to start on
Well,
that
I'll
one?
start, and
Yes,
then Nick
thank
can
you.
give you all the science behind it. And really, it will be from advice from Dr. Brink. And the thing is, we've got a novel virus here. We can see what's happening in the rest of the world, but different countries are doing different things. And I think every jurisdiction has done something unique. So it's very difficult to say, right here, right now, if we do this, by month 3 we'll be fine, and it would just be the borders that are closed. We also don't know how what might happen by releasing at each stage. It really is by taking the evidence and deciding from what the evidence shows us when we can move, rather than say, right, this is the plan, this is what we expect, so we know by week 2 we'll be doing this. We really can't say that. It's got to be governed by the evidence that we're getting about what's happening around the islands.
Great. Dr. Brink.
So one of the key things I would look at is community seeding. And we had one possible case of community seeding which we diagnosed a day or so ago. So there still are the odd cases popping up which we need to test, contact, trace and quarantine very, very promptly. So I think what we'd be using is a combination of parameters. And what I do when I looked at the decrease of the numbers we've had, I'm always trying to sense check and define whether our information that we're looking at is correct. So we look at our community seeding, we backtrack and we look at our hospital capacity. We've got, 3 or 4 people as inpatients today. So we have very few inpatients and we have no one in intensive care. So there's nothing telling me that our intelligence is wrong. That we have large amounts of community seeding. So we'd be looking at a continuance of that, and we're going to be looking at a number of parameters. So we'll be looking at community seeding, we'll be looking at intensive care, we'll be looking at the hospital capacity, but looking at wider cases. Do we have any evidence of outbreaks or clusters? So it's a combination of everything together, and from there, when we're confident that we are on top of each stage, we'll then move to the next. What I don't want to do is define it and raise expectations and say, well, we'll do this in 2 weeks' time. Because as I said with the schools, we're planning to have them closed to half term. But if everything went really well, we could possibly open early. But our plan is to that date. So when we'll come out of this, I think it's unlikely that we'll see a vaccine before early next year. First quarter, possibly even the second quarter of next year. So I think some of these measures will have to be in for a prolonged period of time. But our aim is to get the bailiwick moving as fast as we can. So that's why we've published what we're going to do with regard to our exit strategy. And we'll move to each step as soon as we safely think we can. The critical thing I'd be looking at is community seeding. So that's the one thing that I'd be really looking at very closely. So to answer your question, I hope in a bit of a roundabout way, but I think it's given you a flavour of what we want to do.
Paul?
Yeah, and if I can add to that, what we want to do, we want to try and be able to share the logic of thinking and the logic of planning with the community. So actually, as we've gone so far from week to week and different changes have been made, people have asked us how we've reached that decision and particularly where it starts to affect communities such as business and social activity. So the idea is, and we're working very hard to, obviously, as Dr. Brink refines our exits plan, that there's 2 core other considerations that need to be made. Clearly a transition to return business to normal over a period of time, and that will be over a period of 4 phases. And as Deputy Salisbury made good point, we can't say exactly the dates or the timeline because it'll go very much on Dr. Brink's strategy for managing control and management of the virus in our bubble, both on Guernsey and the extended bailiwick. And thirdly, there's a third element to that, which will be our social transition. So return to normal activity, clubs, sports, leisure, pastimes, has to be cognizant or aligned with Dr. Brink's strategy and the return to business. And that's what we're working on very hard to refine those plans. And then with agreement politically and with Dr. Brink, we'll make those available to the community, hopefully next week, as Deputy Salisbury says.
So it's very much seeking to avoid putting any, the phrase I've used is putting a ring around a date in the calendar.
Absolutely.
We're going to continue to avoid seeking to do that until we're certain, as we were last week, that we were going to make the move this week. But maintaining flexibility is very important as well, so that we can respond to the changing evidence.
So just one other comment is, the reason why we're pushing to start easing some of the lockdown that we've been in is that we're very aware that we've focused on a novel infectious agent and the transmission of that infectious agent within our community. But there are far broader public health issues here, so we want to now take a more helicopter view of the whole health and well-being of the population, and that's more than the very narrow transmission of infection. So we want to hold on to our gains there, but now look at what we can do is move away and look at the broader well-being of our population. So looking at what else we can do in relation to mental and physical well-being. And it's combining that with holding on to the gains that we've got in the control of the virus. So it's a combination of the two, isn't it? Yeah.
Great, thank you. Ian.
Ewan Duncan, BBC Guernsey. Just a quick question for you, Dr. Brink. How confident are you in the contact tracing which is going on, which we know is linked to getting out of various phases? In one case that we know of, an essential worker who was told to be contacted by public health after their housemate had tested positive for coronavirus was then called 10 days later. In that time, they were told to return to normal life and we'll get in touch with you. Do you think that cases like that might be putting the rest of the population at risk and risking us moving through the phases?
I'm not aware of the case you're talking about, but I certainly would be interested to hear more details about that. But on general, do I think the contact tracing is working? Well, I think you've only got to look at the evidence. I think it's worked phenomenally well. No system is going to be entirely without error, and I think we need to that's a fact of what we do. But I think by and large our ability to contact trace and get hold of contacts has been enormously successful, and that has, I think, been the linchpin in our actual moving and flattening of the curve. So I think that's really important. Are there individual cases? I'm not aware of the cases I said you're speaking about, but there could be individual cases. But overall, I think it has been phenomenally successful.
I would just say, if somebody is in that situation, rather than going to the media and saying, look, I haven't been seen for 10 days, I do quite know, why haven't I? To actually contact public health and Nikki, and then they could either put their minds at rest or say, okay, right, we might not pick these people up, because as Nikki said, even Nikki isn't perfect. Things can go wrong, but generally it's the evidence speaks for itself at the moment.
And certainly I've had a couple of people contact me in the last 3 or 4 weeks with similar concerns in relation to themselves or friends or family, and actually when those have been referred through for further investigation or inquiry, there is normally an explanation that is satisfactory to the individual concerned. So I absolutely take Deputy Salisbury's point that if people have got concerns,
contact us,
get in touch and don't necessarily sit on it. Maisie.
Maisie Foot, Bailiwick Express. Going back to the phases, do you think it's likely that we might be able to move within the bailiwick, so for example to Ham or Sark, before our borders are opened completely?
Do you want to answer?
Well, it's a good question. I mean, very much when it comes to Sark, they have basically they put their borders up around, I think it was the 20th of March, and it was their decision to do so. So again, it might be their decision whether people from Guernsey can move there. But again, it is probably more likely that we'll be able to have travel within the islands, and that would be easier than locking out from outside, because we know we don't have any cases there. So that, on the evidence we have at the moment, that seems to make sense, but we don't know what the future will hold, but we do know that our national border, our borders with the UK, France, are likely to be the last things to be lifted.
Yeah, good. Yes.
Charlotte Gay, ITV Channel, sort of follows on from that question really. With Sark, they've recently had a lot of outdoor workers that have gone able to return. With Alderney, they again haven't had any cases. Could rules there be softened and they follow their own tailored approach rather than following the broader bailiwick approach?
Well, I'll start, and I think it's important. Nikki has a comment here. Yeah, well, in terms of the outdoor workers, that would hopefully be resolved from Saturday anyway. I know they had issues around takeaways and such like, and their concerns are, they say they haven't got any cases, so why not? But there are wider implications here as well. Alderney residents still do visit Guernsey for medical reasons, so they haven't closed their borders in the same way as Sark. But yes, we are considering whether we could do specific things for Alderney and Sark, because we know they're in a different situation, their economies are different as well. But I think that's where Nikki comes in to give that further background from the actually the virus and the transmission and the risk.
Yeah. Yes, and I mean, we're always willing to consider alternative approaches. I think what we've got to be very cognizant of is that this virus has caused enormous problems in the over 65s and particularly in elderly populations. And we know that Alderney is further along the ageing demographic than we are in Guernsey. So I think we've got to be careful when we talk about relaxing restrictions that we protect the health and well-being of the population at the same time. So nothing is going to be a risk-free approach, and I think we need to balance the risk with the greater freedom very carefully when we consider the health of our entire population.
Okay, next question.
A question for you, Deputy St Pierre. We know the States has been remotely sitting this week. There's a number of items on the agenda which all require capital funding. In terms of the economy, and we've spoken about this, and spending big money on projects, do you think that you have the backing of the States to spend that money to reinvigorate the economy? Is the best thing to do to learn from lessons of the past where Guernsey didn't spend and it was to the detriment of the economy? And should we be looking at that and thinking, this time let's do it differently, or is that the wrong approach?
Yeah, I mean, I think, again, it's quite early in this, to be frank, it's quite early in this process in that we're sort of still going into the economic problems, and actually, as I've said before, merging out of it is probably going to take longer than the public health experience. I think what I would say is generically is that an austerity approach, if we think that the way to solve the fact that we are going to have a ballooning deficit in 2020, which we talked about a need for 170 to 190 million, and the way to solve that is either by massively cutting spending somewhere else within the budget or massively increasing taxation, then we're barking up completely the wrong tree. In essence, that austerity approach was the approach that we have adopted in the post-010, post-global financial crisis response to our budget deficit. Was we wanted to close the black hole, move back to surplus, and that is, of course, is what we did over an extended 5 or 6 year period, bringing us to surpluses in 2017 and 2018. But this is a completely different economic experience. This is a very, very short-term, short and sharp economic shock to the system, which is why government is responding in a very different way by pumping in literally hundreds of millions of pounds to support business, so that we don't destroy a good chunk of our economic fabric, so that actually, hopefully, it will be a V-shaped economic recovery and experience. When it comes to capital projects in particular, and that has, as you've said, formed the backdrop to a number of debates, a couple of the debates we've had today or this week, because those policy letters were already in the system. Those were projects which were part of our current capital project programme, the Landcrest anti-tank wall and the inert waste project. And what Policy and Resources have said is actually, yes, absolutely, we're going to need to look at our capital programme. We are going to need to reprioritise it. We're going to need to decide which projects we want to accelerate, which projects we want to decelerate, which projects might be better for the local economy and local contractors, which may not. We haven't done any of that yet, but we will need to do it over the coming few months. But in the meantime, we shouldn't be making knee-jerk responses to take things radically off the table, which is why we opposed, for example, the CERSI in relation to the inert waste project that was voted on just before lunchtime. So all of this, I'm giving a long answer, but it's a very important question. there is an awful lot of work still to be done on looking at the consequences of this economic shock and our recovery plan. We've only just begun that process, but it is going to require quite a different approach to the one that we adopted, quite rightly in my view, post 2008 in relation to a completely different experience. I don't know whether you have any further comments.
Yeah, from my view personally, I think we can also look at this as an opportunity to see what do we want our future to look at. We've had a big shock to the system. Life won't be normal through the end of it, but it's our opportunity to say, what do we want the bailiwick to be? What are things that are important to us? And for me, I think that's what we've got to have at the forefront of our minds as we think about the decisions we make.
And that's where the reprioritisation comes in, because we will have to reprioritise everything.
Just a slightly follow-up question. How much will you seek confidence from the business industry in Guernsey and their confidence in what you're doing? We've got a survey here that says 95% of respondents say they think their businesses are resilient. So there's clearly a show that they think they're going to be all right through this. They've said that there is a freeze on recruitment, but they are very reluctant to make any redundancies due to mainly it's quite difficult to hire staff, but they want to keep the core of their business going. How much confidence will you take from what they're saying into what you can do with the economy?
I mean, I hadn't seen that survey, and that's the first I've heard of it. But I mean, I am very encouraged by that. In a way, I'm not terribly surprised, because we went into this in good shape, both economically and from a public finances point of view. So I think providing business has confidence in the whole approach and it can see the light at the end of the tunnel, both in a public health crisis, but also in terms of the economic crisis. In other words, it has confidence that government actually is planning ahead, it has got a grip of the situation, then I think that will reinforce their own confidence. So it becomes a virtuous circle in a sense that actually if government is displaying leadership and confidence, then that will give confidence to business that will enable them to make decisions not to start making people redundant and to be able to invest in the future and so on. So I think we definitely need to be working together. The level of dialogue that's been going on between government and industry and business in the last 5 weeks has been phenomenal. There's been daily contact. Deputy Trott has been leading that from the Policy and Resources Committee, but there have been others as well. The members of the Economic Development Committee, Deputy Mooney and Dudley Owen and Parkinson have all been involved with talking to industry about their concerns. So it is important that we maintain that confidence. I think, Charlotte, you had a question.
Yes, this is on the issue of people being able to buy and sell and move homes at the moment. From what I understand is that from tomorrow, that process will now go through the courts and people can do that. But moving companies can't work because of the social distancing rules. Now, I know a lot of elements, you've looked at the full picture of who can work and what the sort of knock-on effects would be. But in this situation, does that sort of mean that selling houses has become a bit redundant if people can't actually have the capacity to move, if moving companies can't?
No, we're looking at putting out guidance for removal companies in a very short time, either today or early next week.
As ever, I think whenever there is, and we will experience this again, when we make a change to the environment, there will be a series of consequential issues that emerge, and this is one of those that will need to be addressed. So.
Which the committee's constantly having to look at, the implications of you do one thing, something else needs to happen, and that is definitely one that we've already flagged.
Okay, next question. Yes.
The States obviously has a number of multi-million-pound contracts with companies to provide services, for example CT Plus providing the bus service. Obviously, not all those services are currently able to be provided. Has the States looked at possibly renegotiating some current contracts? Because obviously money's about to be quite tight, and obviously I imagine wherever savings can be made, you must be quite keen to look at that.
Paul, could you deal with that one?
Yes, we have a number of contracts that are provided both on and off island, and we are working for throughout the whole range to see, do we need that level of service at all? Does it need to be paid at? Do we need to renegotiate another value in terms of pricing to that? So just as Deputy St Pierre said, we are also having to catch up on these sort of routine longer term considerations, and that's very much what we're engaged in at the moment.
Okay. Mr. Maisie?
Deputy St Pierre, do you have, it might be too early to tell yet, but do you have any idea of the scale of losses that Aurigny is building up and how that might be dealt with in the years to come?
Well, I mean, the policy letter talks about a level of funding around about 27 million. Again, I think it's very difficult to put a hard number on that at this point, because it almost goes back to your previous question in terms of understanding the level of movement there's going to be not only within the bailiwick but actually out of the bailiwick, and when that's going to happen, and that in turn will, as we've said I think at the last press conference, may be dictated by what's happening outside our borders in France and the UK. So there are a lot of variables in there. So when is Orkney going to be getting back to business as usual in terms of their flight network? I don't think anybody can really say. What will the whole airline sector look like? What will the level of competition look like when they do? I don't think we can say. Will that mean the airline will be bigger or smaller? All of these are variables. So I think, in essence, the airline, the whole airline is really is sitting there in a sort of state of readiness. It is obviously providing the lifeline connection at the moment with Southampton. We will want it as a community to be ready to go when we need it. But I think it certainly, yet again as a strategic asset of the bailiwick, I think we will be grateful for that when that day comes. But what the level of losses will be between now and then, I think it's very hard to say, because the whole shape of the industry, the level of amount of travel may be different, just in terms of how we all view that experience in the future. So it's a very good question, but yet, as with so many questions, actually quite hard to give a fully formed answer at this point. Yep, Ewan.
A question about 4G internet access. There's been a few complaints from islanders that they're not getting the level of internet access they require to possibly work from home, or it's affecting their children's education, health and well-being. Do you think that local services are good enough to cope with the demand? And is there work that can be done to work with local telecom companies to make sure that we can get the services we need? Yeah,
I mean, Paul, you may have a comment here on the back of anything that from the Chief Information Officer, but from my perspective, it's certainly an issue that I was conscious of quite early into the lockdown, as will we have enough bandwidth for the island to be working at home and being educated at home. And at that stage, received a reasonable level of reassurance. I've actually only had a couple of complaints that have come to me from individuals that have expressed that, and those again have been referred on to the suppliers and have generally been resolved. So I think actually the sitting of the States today, a number of members were complaining that their connection wasn't particularly good this morning. So I think my experience is largely anecdotal. It seems to largely be working, but I haven't got a great body of evidence that's not the case. But I don't know, Paul, whether you've picked up anything different?
No, I don't think I have a lot further to add on, other than to say that we are conscious. I think, I mean, the island generally has good network cover, good broadband facility, but we're also conscious there is usages going up incredibly, particularly with distance learning, and also just domestically people are actually online a lot more, and there is an effective dialogue continuously going on between the States through our communications information officer and obviously the various telcos of what we're doing to support the island, and it's quite active. But of course I think individuals are seeing actually their own provision and contracts with those private operators are going to have to adjust and maybe purchase more for themselves.
Yeah, I think in the first instance it's a dialogue with the household's own provider. Absolutely. Because it may be, as Paul says, that actually it's simply a lack of bandwidth going into that house, and actually with everybody at home suddenly using their own devices at the same time, it's not necessarily a network problem, it's actually almost a contractual problem between the individual and the supplier. So I think in the first instance, if people are experiencing that, talk to their provider. Yep, Charlotte.
I just wanted to ask a question about, we've talked about looking at balancing other illnesses and everything outside of coronavirus. With routine screenings that would have normally been going on for cervical, breast cancer, all those things, obviously it's not the priority at the moment, but what is being looked at to bring those back online, and so we aren't missing opportunities to spot signs of cancer early?
So I think there are two things. The screening programs, yes, we would like to see those operational again as soon as we can. And I think that's really important because I think many of you know one of our other major programs in public health was the elimination of cervical cancer as a public health problem in the bailiwick. So really important again that we don't lose our ground on that. So with those programs, we would like to see them operational. I don't want to put a particular time on that, but I would think in the latter part of this year, we'd really want to see those programs up and running again. So that's that part of it. There is another issue, and I know Dr. Raby has mentioned this before, is people delaying seeing a doctor for medical issues. So, and we wouldn't want to see that, would we? I think I'll let you maybe comment on that.
Yeah, absolutely not. If you've got symptoms that worry you, please see your doctor, phone your doctor and speak to your doctor. A lot of this can be done, sorted out with virtual consultations. With the bowel cancer screening program in particular, a positive, we're using fit testing for that. And the trouble with the positive fit test is that you then need to go for a colonoscopy, which is an aerosol generating procedure. So it's a problem for us to do that just now. And some people I know have contacted us to say they're worried because they're sort of in between a fit test result and getting their colonoscopies and stuff. We will get through them. I know people are worried about it. And as soon as we can restart the bowel cancer screening program, the breast cancer program, all the screening programs, we will. We're very aware that we don't want people coming to harm.
Okay, question.
This question for Dr. Brink. We've seen some studies relating to pollution and obviously the connection with obviously more serious pollution resulting in more COVID-19 complications among patients. I think the WHO have also flagged it up as not necessarily being directly linked, but obviously something that seems to be taking place. I mean, looking at our local pollution levels, is that something that obviously doesn't concern you so much in Guernsey? Because obviously I assume our pollution levels are relatively low.
Yeah. So yes, our pollution levels are relatively low, and I'll let Dr. Raby answer some of the details, but it's not unexpected that there's an association with air pollution and a respiratory disease, because those two often go hand in hand with regard to disease severity. But I think you've got some extra information.
Yeah, that's exactly right. So there's some, you've probably seen some information from a group in Harvard and others looking at does high air pollution level increase your mortality from COVID should you get it? And there seems to be some evidence that perhaps it does. It's not strong yet, but we know, as Nikki said, that if you get pneumonia in a high air pollution area, you're more likely to die, for example. So it seems reasonable to believe that, and I think on the whole the bailiwick could be in a good position with that.
Good. Next question. Yep, yeah.
Question either for Dr. Brink or Deputy Soulsby. You mentioned, Dr. Brink, in your opening about children and looking after them. How much consideration is being taken into children who might be at home, there might be issues at home in terms of child abuse, which we've spoken about previously, in them returning to school as well as the key workers' children? Is that something that's been looked at?
So vulnerable children are eligible to be at school, so we know that, and that includes children that, for example, have child protection orders, children that, so there are various groups of children that are already entitled to be at school, and we think it's really important. And I brought up the issue of vulnerable children because I think it's one that we need to keep at the forefront of our thoughts. So not only are they, with regard to the social workers are still visiting them, that's really important, so child protection visits are still occurring, but there are groups of children that are entitled, vulnerable children that are entitled to be at school, and we would very much support that and support those children being in the school environment, obviously at the same time working with their parents and carers. So groups such as Looked After Children and so on are absolutely entitled to be in the school environment, and would strongly support that, and I think that's really important. And I think this is a group of individuals that we mustn't forget about. That
how close are you, how close are you working with social services to be able to identify those children?
So that's done through social services. So the regular social work visits are still occurring. So all of the those visits are occurring, and as I say, within the schools as well. So I think that's a group that we need to focus on. The respite care is still happening through the Croft, and as I said, they've been quite imaginative about moving some of the activities outdoor. So that is fundamentally with children's social services, children's social workers, and when I spoke to them today, they said they're still very actively involved in that.
I'll just add, we've still got the multi-agency support hub that's involved in all these matters up and running. I did mention a couple of weeks ago the concerns that the referrals have gone down, really wanting people, if they've got concerns, to contact them. All the details are on the coronavirus website, and there's also SAFER and their details on there as well. So there are a lot of support networks and advice that is available for people if they have got concerns.
Good, thank you. Time for one more, well, maybe two more. Go on, Maisie.
Dr. Brink, I appreciate you're not really able to comment on individual cases, but are you able to give any more detail on this latest death that we've had, like a demographic? Were they in a care home, for example?
So the latest death is an individual from one of the care homes, and again over 80 years of age, but I wouldn't want to give any other details. What we do with our death announcements is we shift them by 24 hours to make sure that all the family have been informed and so on. So we're very cognizant of that's a family member, and we want to be respectful to the individual and to their family as well. So just some very basic details. I'm sorry, but you know, we need to respect that.
Okay. Julie.
And it's a fairly quick one. I know it's probably coming up in Deputy Soulsby's recreational guidelines, but I understand over the last few days the surfing at Bazar has been amazing. And the surfers of Guernsey seem to have definitely taken that on board, because I understand it's been very, very busy down there. Is this a concern to the board? And I mean, is this something that's going to be covered in your guidance?
Well, people are allowed to surf at the moment. The important thing is that they maintain the social distancing, and we've laid out what that is and what they need to do. If they do rock up and they see about 100 people in the car park, probably just think that it's not the right thing to do. I think the police are looking to see if places appear more crowded than they should be, and that would be part of their role. But so all around the social distancing, where is the risk? You might have a lot of people on surfboards at sea, but if they're 2 metres apart, which you'd probably hope that they would be doing what they're doing, the risk is minimised. More risk is if they all come on the beach and they're all congregate, which they shouldn't do. So it's all about understanding what is it we're trying to do here, you know, and it's about, and this will be something I suspect will be the last thing, and that will go and probably will continue for quite a while, is the whole concept of needing to keep your distance and maintain strict hygiene.
Yeah, and I think, as you know, it will be covered in the guidance when published, and hopefully that's next week. But it's a theme that we pick up in a lot of meetings that we're in with the outside, could be the business community, even working with ourselves, is a realisation that sometimes it's an expectation will probably be about another month or another 8 weeks. I think as a community we've got to realise that, and Dr. Brink would talk to this far better than I could, but until the vaccine is established and until the vaccine is then rolled out within the communities and communities outside this island, which would affect borders, we're in this for quite some time, albeit, I think, as Deputy St-Pierre alludes to, we want to work within our bubble that is the bailiwick, so we can actually resume as much as we can in a return to normal within the context of still management. There will be an element of controls on how we go about our daily lives until we establish that vaccination regime.
It's all about managing risk. What we did in lockdown is enable people still to move around who were considered essential workers. Now we're looking at things in terms of the risk to the community, in terms of people being able to do things as normal as what they used to do, or the jobs that they've done. And this is something I whittled along a lot about when I was chair of the Public Accounts Committee. And Gavin was on the other end of those conversations. It's about managing that risk. You can eliminate risk totally and lock everybody down for a year, and that would not work. You've got to allow an amount of risk to balance the other issues that are there in terms of mental health and well-being and the economy. It's getting that balance right, and also, most importantly, ensuring that we keep that public health view and understanding what is the overall risk to the community.
Great, well thank you very much. We will meet again, we're going to have two media events next week on Tuesday and Friday at 1 p.m. Final message from me is a repetition of one that we've had before, which is stay at home. It remains the key message for phase 2. Unless you have reason to be elsewhere for whatever reason, please continue to stay at home in your own household bubble. If you do have questions or concerns, do continue to field those to the various helplines, email addresses. If it's whether it's vulnerable children, if there are mental health issues, then and mental well-being issues, then talk to all the charities that are there for you. So it's a whole range of other things that we've discussed. Whether it's business support, continue to stay in touch with government and all the agencies that are there for you. But in the meantime, please do continue to stay at home, and we will see you next week. Thank you very much.